In this particular episode, I'm going to discuss about the very fundamental question as to whether people with hypothyroidism, once started on thyroxine medication, can stop this medication. Basically, let's discuss about what thyroid hormone does to the body. Thyroid hormone is a hormone, that means a chemical that is secreted from the thyroid gland. It is essential for each and every cell of our body and for the normal metabolism in our body. If the thyroid gland does not secrete adequate amounts of thyroxine, that means the thyroid hormone, then the metabolism in the body does not go well. In order to control this properly, in people with hypothyroidism, that means underactive thyroid gland wherein the thyroid gland is not secreting adequate thyroid hormone, specialists and physicians do start a tablet called thyroxine, which is a supplement in lieu of the thyroid hormone that is not being produced adequately in the body. So, this thyroxine tablet becomes very essential for the normal functioning of the body, for each and every cell of the body. If any individual who has been diagnosed with hypothyroidism and is supposed to be on thyroxine tablet does not take the tablet and stops it on his or her own, then the body does not function well. For instance, the individual can develop symptoms such as cold intolerance, that means feeling excessively cold when everyone is feeling hot. The individual might put on excessive weight, have excessive hair fall, develop constipation, dry skin. In women, they can develop fertility issues and also issues related to their menstrual periods, so on and so forth. Apart from this, if the individual does not take thyroxine tablet for several weeks and months, then the person can develop problems related to the heart, problems related to high blood pressure, problems related to bone metabolism, and sometimes even end up in coma and may even die. Hence the reason why we advise our patients not to self-adjust the dose of thyroxine tablet or to stop the thyroid medication on their own. It is very important to take appropriate medical advice before changing the dose of thyroxine tablet or taking a misadventure of stopping it at all. On a slightly different note, there are certain circumstances wherein your specialist might be able to stop the thyroxine tablet. For instance, if at all this thyroxine was started during pregnancy for a subtle thyroid dysfunction that has been picked up during pregnancy, then the specialist might be able to stop the thyroxine tablet in certain circumstances after the delivery. Also, in certain scenarios of subclinical hypothyroidism, that means when the thyroid dysfunction is very mild, in order to tease out if the symptoms of this individual would improve with thyroid hormone supplement, in certain instances the specialist might try a small dose of thyroxine tablet, and if symptoms don't get better with that small dose of thyroxine tablet, the specialist might stop the thyroxine supplement after a few weeks. Except in such rare scenarios, usually in the textbook hypothyroid cases, it is unlikely that an individual would be able to stop thyroxine tablet altogether, and it is strongly advised that laymen or non-professionals make any changes to the doses to their thyroid hormone tablets or stop the thyroxine tablet on their own. Thank you very much. Take care.